Hello, Washington chiropractors. Last week we reported on the enactment of SSB 5169, the PPE reimbursement law. Since then, we've received a wave of questions all along the same lines, so I'd like to take this opportunity to explain some of the murkier points of this law. The most common question that we've received is, who can I bill this code to? 99072 can only be billed to Washington state regulated health plans. That means the law does not apply to Medicare, Medicaid, PIP, LNI, or self-insured health plans. There are also a few private health plans that this law does not apply to either, such as those that are negotiated by unions, otherwise known as Taft-Hartley plans. These are federally regulated by ERISA, so they are not subject to this state law. If you bill any entity that is not a state-regulated health plan, the code will be denied. The follow-up to that question is, can I bill the patient? No. 99072 cannot be billed to the patient at all. The law specifically says that there can be no cost sharing by patients at all, which means that the insurer cannot apply the cost to coinsurance or copays. The $6.57 reimbursement is the exclusive responsibility of the insurer. Another common question is some variation of why $6.57, or can I bill a higher or lower amount based on my actual PPE costs? $6.57 is the amount that legislators ultimately agreed to after lengthy negotiations with various stakeholders. I'm not aware of any particular formula that was used to calculate that amount, but that doesn't really matter. The fact is, $6.57 is what's listed in the statute, so that's what you bill. Regardless of what your actual PPE costs are, $6.57 is the amount that the Washington State Legislature says you get. Others have asked, can I just round it up to $7 so that it's a clean number? No, you cannot round the rate up to $7. Many might try this, reasoning that the insurer will just reduce it to the allowable amount, but that is highly unlikely. Rounding up would be viewed as a cash grab and would not represent a good faith effort to comply with the law. The good thing about this admittedly odd number is that it's not just the amount that the Washington State Legislature says you can bill. It's also the amount that the legislature says the insurer must pay. But because the amount is specified in law, billing anything in excess of that amount will likely result in a denial. One other person asked, can I round it down to $6? Yes, I suppose you could, but then you would be foregoing 57 cents that you're otherwise entitled to. It may not seem like much, but over time it does add up. Additionally, this is the amount that the insurers will be entering into their own systems. So anything other than that amount is likely to draw further attention to your billing. Even though rounding down would save the insurer money, doing so could still be seen as not fully complying with the law as it is written. Others have asked, do I need to apply a modifier to this code, and what do I put in the chart notes? Nope, you don't need to put any modifier on there. Just bill the code at the statutory rate. And as far as what you put in the chart notes, I would just put in COVID PPE. Another common question is, when can I bill for this code? The law took effect on Friday, April 16th, 2021, and the code can be billed for as long as the federal state of emergency relating to COVID is still in effect. The WSCA will report when the U.S. Department of Health and Human Services lifts the state of emergency, as well as the last date of service that you're able to bill for this code. Until then, you can bill it for every patient encounter where the third-party payer is a state-regulated health plan. And that leads to another question. What do you define as a patient encounter? Well, a new patient encounter would be any episode of care that requires a new entry into the patient's chart. In most cases, that's once per day, per patient, per provider. However, in the unlikely scenario where a patient comes in the morning and then comes back in later in the day for a separate issue, that could potentially be viewed as two separate encounters. What is more likely to happen is a DC sees a patient and then the patient sees a massage therapist during the same visit. This could potentially be seen as two separate encounters. But if both providers are billing under the same tax ID, it could raise a red flag. Because of this, it's best if you just bill 99072 once per day per patient. And that one leads to another question too. Does this apply to massage and acupuncture as well? Yes, this law applies to every provider type. So if a patient comes in and doesn't see the DC, but does have a massage, the massage therapist can still bill for it. However, I would note that if you're licensed in multiple disciplines, like chiropractic and acupuncture, then you should still adhere to the once per day per patient rule. A few have asked, what if the insurer audits me? Won't I have to substantiate the reasonableness of the charge? The answer to this question is no. Regardless of what your actual PPE costs are, the amount is set in statute. So if you are audited, you only need to show that you complied with the law. The law says you get $657 for 99072. This is another good reason not to round up or down. Even if it's more convenient, deviating from what's set in law will raise red flags. An uncommon scenario, but one that has been brought up anyway, is I live in a border town and I work in clinics on both sides of the state line. Can I bill this to patients I treat in Oregon or Idaho? This one is also a no. This law is exclusive to Washington State and doesn't apply anywhere else. Even if you treat the same patient on subsequent days in 2 different states, you'll only be guaranteed $657 for 99072 if you bill in Washington State to a state-regulated health plan. Finally, some have reached out to other sources and heard contradictory information. For instance, I reached out to my practice management software company, and they told me that it couldn't be 100% insurance paid. Or I reached out to a well-known compliance educator, and they said that I need to track my expenses in order to bill 99072. Why are they telling me this? These are good questions, and normally those entities are good sources of information. However, both your software provider and national educators are focused on the big picture, issues that affect everyone. This new law only applies in Washington State, and when I say new, I mean that it became law less than a week ago. National entities track legislative changes, and ordinarily, changes to the law take effect months after the session ends. This law had an emergency clause in it, which made it take effect immediately. It takes time for nationally focused businesses to conform to new laws. Your software provider probably has heard about this change, but they haven't had the opportunity to implement a solution in their systems yet. Moreover, that information likely hasn't filtered down to the customer service rep that your staff is talking to. I'm reaching out to major software providers now to find out their timelines for implementation. Once I know them, I'll report back to you. But for now, understand that no matter what any out-of-state entity says, this law is in effect now, and you must apply it as I have described here. This has been an unprecedented legislative session, and despite all the challenges that it presented, the WSCA lobbyist, Lori Grassi, has done an excellent job advocating for chiropractors. Her work in getting this law enacted bridged a gulf in provider reimbursement that could not have been predicted. No law is perfect, but this one protects your patients and makes sure that you get reimbursed for an expense that no one could see coming. SSB 5169 is a great example of how the WSCA is helping chiropractors help patients. If you'd like to learn more about this law and other developments in this legislative session, Lori will be hosting a free webinar at 9 a.m. on Tuesday, May 11th. You can register for that now at www.chirohealth.org/events.